Did you know your practice can receive 100% of the Medicare physician fee schedule amount if the services of your non-physician practitioners meet Incident 2 billing guidelines? Today, many practices are employing mid-level providers or non-physician practitioners to treat more patients effectively. And if the services of non-physician practitioners, or NPPs, meet Medicare's Incident 2 requirements, office visits can result in reimbursement of 100% of the Medicare physician fee schedule instead of the 85% if the NPP bills under their own National Provider Identifier, or NPI. So what exactly do we mean by Incident 2 services? Medicare defines Incident 2 as services or supplies furnished as an integral, although incidental, part of the physician's personal professional services in the course of diagnosis or treatment of an injury or illness. In other words, the services are paid as if the physicians provided them. But to qualify for Incident 2, the services must meet certain requirements. First, the services must be part of your patient's normal course of treatment, during which a physician personally performed the initial service and remains actively involved in the course of treatment. A physician does not have to be physically present in the patient's treatment room while the Incident 2 services are provided, but they must provide direct supervision. This means they must be present in the office suite to render assistance if necessary. Other requirements include an integral part of the patient's treatment course, as we've stated, commonly rendered without charge, included in your physician's bills, of a type commonly furnished in a physician's office or clinic, not in an institutional setting, and an expense to the physician or practice. Now let's talk about the types of patient visits that qualify. Incident 2 billing only applies to an established patient and individuals who receive professional services from the physician or NPP, or another physician of the same group practice or organization within the previous 3 years. So why is that? As I mentioned earlier, remember that the services must be an integral part of the patient's course of treatment. That means that the patient must have had the initial visit or encounter with the physician, and the physician had to have established a course of treatment for it to be an integral part. The patient would be returning for a subsequent visit for the same condition or diagnosis as determined in the initial visit with the physician. If the patient presents with a new condition or complaint while the NPP is rendering the follow-up care, the visit no longer qualifies as Incident 2. There are also certain settings and employment arrangements that qualify for Incident 2 services. So let's discuss those. First, Incident 2 services must be provided in a physician's office or in the patient's home. Second, services must be provided by a qualified individual that a physician directly supervises and who represents a direct financial expense to the physician or an organization that employs the physician. This means they must be a W-2 employee, a leased employee, or an independent contractor. I just mentioned a physician directly supervising qualified individuals, and this is often a question we get from our providers, so let's delve into what that means. If the physician is a solo practitioner, they must directly supervise the care. If it is an organization with a group of physician members or a physician-directed clinic, any physician member can be present in the office and directly supervise the visit. Now let's say the services of the NPP are rendered in the patient's home. The physician must be present in the patient's home providing the direct supervision to qualify as an Incident 2 service. There are a few exceptions to this direct supervision requirement, but only for homebound patients in medically underserved areas where there is no available home healthcare services. In that case, general supervision of the service is allowed, meaning the physician must be available by telephone. Let's discuss the settings where you cannot bill for Incident 2. This includes hospital and skilled nursing facility settings. If a physician does have an office in an institutional setting, the office must be confined to a separately identifiable part of the facility and cannot be construed to extend throughout the entire facility. If a physician rents space in a facility and the practice is independent, not a department of the hospital or a provider-based clinic, for example, then the physician may bill Incident 2 services in that office. And one last note. Neither ambulance services nor emergency medical technician services performed under a physician's telephone supervision is billable as Incident 2 services. So now that we've defined Incident 2, covered the qualification requirements, and reviewed the types of settings that do and don't meet the requirements, let's look at the qualified NPPs who can render Incident 2 services. NPPs that can provide Incident 2 services include physician assistant, nurse practitioners, clinical nurse specialists, nurse midwives, and clinical psychologists. These NPPs may also supervise Incident to services, but the services are reimbursed at 85% of the physician fee schedule, not 100%. The same would apply to services they render that don't meet Incident to requirements. These non-physician practitioners can still bill for their services. However, the services are reimbursed at 85% of the physician fee schedule, not 100%. So we've talked about services that qualify as Incident to, the types of settings, and who can provide Incident to services. Now let's test your knowledge of the guidelines we've just covered to determine if the services qualify for Incident to billing. To do this, we're going to look at specific scenarios and apply the Incident to guidelines. Scenario 1. A physician sees a new patient and diagnoses them with type 2 diabetes. The physician develops the course of treatment that includes a new prescription and tells the patient to return in 3 months for a follow-up visit following blood work. The patient returns for a follow-up 3 months later and sees the nurse practitioner in the office. The physician is on site at the time of the follow-up visit. During the visit, the patient presents with a new complaint of knee pain from gardening over the weekend. The nurse practitioner evaluates and treats the patient for the knee pain and swelling with a cortisone injection and discusses the results of the blood work. Does this scenario meet Incident to requirements? No. The Incident to requirements are not met because the patient presented with a new complaint, knee pain, and swelling from gardening over the weekend. The nurse practitioner can bill for the service under their own NPI, but not the NPI of the supervising physician on site at the time. Scenario 2. A patient comes to a physician-directed clinic for a follow-up. The key term here is physician-directed clinic. The patient's primary care physician originally diagnosed the patient with muscle strain in her lower back and prescribed anti-inflammatory medicine. On the day of the follow-up, the patient's physician is conducting rounds at the hospital, so the patient is seen by a physician assistant. The patient is doing well, and muscle strain has been alleviated. Does this meet Incident to requirements? Yes! Medicare recognizes a physician-directed clinic as having a physician on the premises at all times the clinic is open. Another physician in the clinic can serve as supervising physician at the time of the encounter. It doesn't have to be the same physician on the premises who developed the treatment plan. Just be sure to indicate the physician supervising as the rendering provider on the claim at the time of this visit, not the primary care physician who was off the premises making rounds at the hospital. Okay, I bet you're doing great so far, so let's move on to scenario 3. A nurse practitioner sees a Medicare patient for the initial visit and sets up a treatment plan. She bills under her own NPI because it is an initial visit. The patient returns for a second visit with the same nurse practitioner, and this time there is a supervising physician on site providing direct supervision. Can that subsequent visit be billed to Incident to? The answer is no. The physician must have first conducted the initial visit and developed the plan of treatment. The nurse practitioner is required to bill under their own NPI. Okay, let's move on to our final scenario. A physician is currently treating a patient for hypertension. The patient presents to the office with an upper respiratory infection and sees a physician assistant in the same group practice. Another physician in the group is on the premises providing direct supervision. Can this be billed as an Incident to service? The answer is no. A physician must have first conducted the initial visit and developed the plan of treatment for the upper respiratory infection. The physician assistant is required to bill with their own NPI. So how did you do? I hope you passed. We have so many more educational resources and FAQs on this topic, including our Incident to self-service tool. This tool helps you apply the rules to your individual patient-provider circumstance and to understand medical documentation requirements. We hope you learn more about applying the Incident to guidelines, and you can visit our website at medicare.fcso.com for more resources and to check out our other educational videos. Thanks for watching.